Welcome back. Not all government health facilities have been exempted from power cuts. So far, the Department of Health says it's provided Eskom with 213 hospitals for possible exclusion from load shedding. Eskom is currently supplying over 30% directly to hospitals, while 67% are connected to the municipal grid. Joining us for this discussion is Dr. Mvuyisi Mzukwa, who is the chairperson of the South African Medical Association. Thank you so much for making time, Dr. Mzukwa. So not all government facilities have been exempted from the power cuts. Under the radar, the former Eskom CEO said last week that it's not possible to exempt all hospitals from load shedding. He says it would be practically impossible.
Good afternoon to you, Clement, and to your viewers, and thanks for having me in your beautiful program. Clement, we've had this argument before presented by both Eskom and government, but what we have not been told is how do you exempt politicians? Because they are also embedded in the network, how with communities. So how do you make that possible? And you cannot, I mean, these are healthy politicians. How can you not make it for hospitals where there are sick patients? I am sure that, you know, when there is a hospital, there are means to make it happen. It's just that there is no political will. That's our view.
Mm-hmm. And in terms of the national state of disaster regulations that were promulgated this week by the COGTA minister, it looks like government can take that decision to exempt essential infrastructure from these power cuts. Do you get a sense that, you know, that's the conversation that can happen between the health minister and Eskom, in spite, of course, of and with the limitations that Under the Radar has mentioned?
Well, we would have thought that that conversation have already started. We thought it has already started. We don't understand why we do not have a clear, proper plan, you know, to exempt hospitals, I mean, from this disaster. You'll understand the impact that it has, you know, on service delivery, but not only that, but also on the security, you know, for healthcare workers. You would not think that, you know, from when it started, there was a plan in place, because those generators, which were told are alternative, are not working at times, so they are not reliable. So you expect, you know, that government to be very sensitive, you know, with the hospitals where there are sick patients and they have nowhere to go. At least politicians can go to private care, but those 80% of population cannot go.
Is government at least trying to, you know, supplement budget to the hospitals? Because we've heard from a number of MECs recently who have complained about running out of money for diesel at these hospitals.
Well, it tells you, I mean, if you hear it from the MECs, they are feeling the pinch. It tells you that there is nothing that is offered, you know, or assistance that comes from, you know, that national office. We should be looking at the, you know, interest of those hospitals. So if MECs are complaining, it tells you clearly there is nothing that is forthcoming. So it is disappointing that, you know, we can allow a situation whereby, you know, sick patients can be just allowed to suffer and die, you know, without the intervention of the national office. Mm-hmm. So this tells you there is nothing coming from them.
Mm. Have we seen lives being put at risk as a result of the power cuts in hospitals? What are your members telling you on the ground?
Oh, many times. As you know, some procedures, they start, there is load shedding, and also there is no, the backup generator cannot kick in. What they do, they finish that operation using torches from their cell phones. We also know that, you know, the electricity generation or distribution is linked to the water pumps as well. You find at times where you do not have water because you don't have electricity. You have backlogs, you know, surgical backlogs sitting at above 150,000. And you can imagine what happens to those patients. So it has a significant impact on the delivery of services in the country.
Mm. Has the minister provided a proper plan to assist hospitals that are not exempted from these power cuts?
Well, you'll recall that last time the minister had a media briefing in this matter. You know, the minister was talking about he is still going to meet Treasury, still going to meet the Minister of State Enterprises. You know, it was all futuristic. There was nothing proper that was on, you know, on the hands of the minister to say this is the plan we are going to be following as the department. So I don't believe that there is a plan, because there are no conversations that are going on regarding this matter. I don't think it is taken as a crisis. You know, I think it's just something that is recognized as a problem that is out there, chronic problem that nothing we can do. All we do is to wring our hands and say we have a problem. Call a media briefing, complain in the media. I mean, I've heard a minister complaining in the media when the minister is government. I mean, why government can't solve the problem? You know, those interdepartmental talks.
Yeah. I remember hearing the minister mention that clinics and even community centers were going to be covered within the solar energy rollout program. He stated, I think, that the National Department of Health is currently conducting a due diligence exercise for the installation of solar panels at all of the health facilities. And I think they were collaborating, if I'm not mistaken, with the Council for the Scientific and Industrial Research. Is that sufficient? Because that's a plan, but then again, that's not going to bring about the relief that we need now. It's going to take some time to put in that infrastructure.
Well, it's a good thing to think about those things. Like you said, we're talking about the now. What are we doing now? Because, I mean, you know, in South Africa, that could take about 20 years, you know. When they present it, think it's coming now, but you know it's going to take long. So we have a problem now, and we want a solution now. So those plans are not really assisting. You know, I would have thought that, you know, by now we've got a plan, whether we inject more cash to the hospitals to say because you do not have enough generation capacity, you need generators and stuff like that. Here is your, these are the finances to assist in this regard. But that's not what is happening. To make matters worse, we are seeing cable theft in the hospitals. You know, even if you have electricity, there's a problem of cable theft. And it's amazing you can have cable theft in the hospitals when there are security officers, security companies that are employed to look after the property of the hospitals. So it's amazing if that can happen.
Well, Dr. Mvuyisi Mzukwa, the chairperson of the South African Medical Association, thank you for joining us for this conversation.